Good morning, good evening, good afternoon, depending whichever part of the world you're all joining us from. On behalf of Beacon House School System, the organizers for School of Tomorrow events, I would like to welcome you all to A World of Tomorrow from Darkness to Light, the 12th edition of School of Tomorrow events. This is an entirely virtual setup that we have here today. The non-for-profit School of Tomorrow events was launched by Beacon House in the year 2000 as part of its CSR and to help inform the direction of the organization, while also involving global communities in conversing, in shaping the future of schools and societies. My name is Taimur Banday. I am the moderator for today's session and representing Beacon House School System. It is my great pleasure to welcome you today to this live session at the 12th edition of School of Tomorrow event. We have an interesting panel here today as well. I would like to bring them in terms of their introductions. We have Dr. Maryam Riaz Tarar. She's a professor of pathology and neurology at Shalama Medical and Dental College, Lahore. She's also a member of the Corona Expert Advisory Group and Ministry of Science and Technology Task Force for COVID-19. We're joined by Dr. Faisal Mahmood from Karachi. He's a former Beaconite. He's also basically sector head infectious diseases at Khan University. He's also the associate professor there. He's the technical advisor for the Sindh government and the federal government. He's also the site principal investigator for the ongoing vaccine trial. Then we have Mr. Omair Rana. He's a stage and television actor, a very renowned personality, an activist, and a very, very known person both in Lahore and I believe in Pakistan. We have lastly Mr. Chattha, an Muslim at the International Olympic Committee. He's also an advocate for Olympism. He's a former debater, debating coach, and academic as well. So thank you all for joining us today. We have a very interesting topic actually today, and before I go on to that, I would like to inform the viewers that all of you can generally write to us. If you look at the comment function on the School of Tomorrow website or on your social media platforms, we'll take on those questions in, say, in the last 10-15 minutes. So you'll be able to give us your comments and views on that as well. Now, COVID is something that we are all affected by. We are all facing it on a daily basis in different parts of the world. There are numerous questions that have cropped up around this. We've seen decisions by the governments. We've seen people react to them differently. But here today, what we are trying to discuss is should we not get vaccinated? Is that something we should go for or should not go for? Before I open the discussion, I think we need a clarity, and I would like to bring in Dr. Faisal over here. Vaccination versus trial medicine, development stages 1, 2, 3. Could you give us a clarity on that?
Sure. Thank you very much for having me, and thank you. Very briefly, I think there's a lot of talk about phase 1 and phase 2 and phase 3, and I think it's important to realize what this means. And this goes beyond vaccine development. This goes for all drug development, actually. And is that we go through this in actually 4 phases: 1, 2, 3, and 4. Phase 1 studies tend to be in a really handful of folks. We're giving the vaccine or the drug to them to see, if there are any adverse effects. And these are generally healthy young adults that we study it on. Phase 2 trials are done on a slightly bigger group, so about 100 or 300 or so folks. And over here, we're trying to see if the drug is having the effect that we want. So in case of vaccines, we actually check the blood to see if it's producing sort of immune response or not. And if a drug or a vaccine passes phase 1 and phase 2, so it's safe, it's producing the effect in the blood. In that case, then we go on to phase 3. And phase 3 is really when you test to see if this works in real life or not. And over here, we gave the vaccine in this case to thousands of people. And to give you an example, for most of these vaccines, be it the one that we're doing here or the ones that were in the press, the Moderna and the Pfizer, we're talking about 30 to 40,000 people that get enrolled in these studies. And we always have to compare with people who don't get the vaccine. So half the folks will get the vaccine, half the folks will not get the vaccine. So they'll get an injection, which is just sort of just normal water. And then what you do is you follow these folks for about a year and you see how many people get the infection. And then obviously, if the number of people who get the infection is higher in those who did not get the vaccine, then we say the vaccine worked. And there are other things, technical things that go into it, but that's sort of the really simplified. And then finally, there's phase 4, and that's when the vaccine is marketed, and then you still sort of following it in the future to see if there are any rare side effects or rare issues that are happening. And that's the last phase.
Yeah, great. I would like to bring in Ms. Tarar. I would like to take your input on this. Say the vaccine is there tomorrow. Do you think everyone will have access to it, or is this going to be something selective? Sorry, I think we've lost a briefly. Ms. Tarar, if we can come to you. Suppose there is a vaccine tomorrow. Do you think everyone will have access to it?
I think as for the access, we have to remember that it is not something as simple as it sounds. Of course, we want it for everybody when it comes, but it will come in stages. For example, it may take up to the next year, the middle of the next year, even after that. It all depends how many doses will be needed, because if you need, there are like 7.7 billion people.
Omair, I would like to bring you in on this one. We've heard about the vaccine being brought to Pakistan and eventually administered on various populations. How do you think the reaction is going to be? You think people are going to be open to it, or is it something that the government will have to force down their throat or educate them about it?
I think nothing of that sort has ever gone down very easy in our state. Unfortunately, we're not a state of people who follow sciences, the language of sciences blindly in any case. Not to say Trump's America has been much exemplary, but we've been very pessimistic about certain things. We belong to a nation which was always, and this is purely my opinion, we like to have a lot of conjecture and rumors, etc. And we would really need a lot of confidence and awareness from the state and every level of that. For me, the greatest concern really will be that who in Pakistan will get it first and how would they receive that. That might perhaps set the right tone and take it further.
Right. Ali, you deal with a lot of students. You are, I'm sure you have access to a lot of views coming from the youth because of your work. What is the mindset there? Are they looking forward to the vaccination? Are they talking about it even, or is this something they're just not bothered by?
The point of view that a lot of young people are coming from is there's a lot of uncertainty around the issue, and that sort of is fed by the uncertainty that schools have, that the government has, and that creates a lot of problems for them. The second part of that problem is the misinformation that is available on social media and on other platforms. These students, of course, this is their primary source of information in a lot of cases, and therefore it kind of feeds into the uncertainty. A lot of students are on the fence as of now. The use of vaccines is perhaps not that far along that they've thought about. But I think that conversations like these are very important, where they understand the difference of science and the stages in which it operates, and therefore gain clarity from that. If conversations like these are not happening, then students are not getting the information they need to make decisions, or perhaps even be clear about what they want to do and where they want to take that decision.
Right. I'd like to share a couple of questions that have been going around commonly, and I'm sure all of you may have heard these as well. And Dr. Maryam, I would like to seek your input on that. We've heard about the fact that there are certain protocols which would be necessary to keep the medicine, I believe, minus 70 degrees, etc. We've heard about the fact that we don't know how long the vaccine will be effective for. So do you need to go back to it, get administered again after 6 months, 1 year? So these are some real questions that have gone around. What are your views on that?
I think you're talking about the cold supply chain. As for the Pfizer vaccine, they have said that it's, minus 70 degrees centigrade, that the requirement for the vaccine. And for the Moderna, I think it's minus 20. But I think there is one thing we have to remember in all this, that this is a new type of vaccine that is being, rolled out. This is a messenger RNA vaccine. It is not like the traditional vaccines. So this is the reason that you do need, such a low temperature for this. And also, this is the first time that it is going to be used. So I don't even know how this will be taken, eventually, because we are so used to the inactivated vaccines and the traditional vaccines, the conjugate vaccines, the split vaccines. So this is the first time that the two companies, in fact, not the two companies, but the other companies, like the German company, which is the CureVac. I think the CureVac trials will start by the end of the year and maybe beginning of the next year. So the temperature requirement for CureVac maybe will be between, perhaps less, 2 to 8 degrees centigrade in the refrigerator, which is a normal refrigerator. So I think the vaccines and the way they have to be kept at temperatures is a very important point. And it can be a make or a break situation for the success of a vaccination, the way you want to take this along, for the general public. They have to understand, because I think if you think about what happened in Africa with the Ebola vaccine, because the temperature requirement was very stringent there as well, as I'm sure Dr. Faisal would, testify to that, because there they had to use these special thermoses which they created. And for that, they would keep, the ice and, have the boxes, and, you can put the vaccine in there. It'll last for a few days, maybe 5 days or 2 weeks at the most, but very expensive boxes that they have been using for, using and, transporting the Ebola vaccine there. So maybe we'll have to resort to something like that eventually for countries, countries like Pakistan, where we can't afford to have these expensive refrigerators. I mean, the cost is horrendous. So, I mean, these things have to be kept in mind.
Yeah, Dr. Faisal, I'll bring the same question to you, but I'll add something else to it. I mean, the other nagging question that has cropped up is that, are there any side effects? Should we expect any side effects? Because, people are scared. This is the first time it's coming.
So I think, and I just want to echo exactly what Dr. Maryam said, and take this forward from there, in that we have to also keep in mind that even though we talk about the COVID vaccine, we're actually talking about many different vaccines over here. So they're actually completely different types of vaccines, with their own sort of limitations and their own benefits. And the ones that are coming out in the press currently, those two vaccines are actually not even being trialed over here or tested over here. And we don't know if they're going to come over here or not. And since each of these vaccines are different, and that's what Dr. Maryam alluded to, each of these vaccines, sort of cold chain, how you can store them, how you can give them, how many vaccine boosters you need to get, and again, coming back to your question, what side effects are going to be, are different. So, for example, to give you a quick rundown, the vaccine that we're doing over here, the major side effect tends to be sort of pain and fever at the site. A similar but a different technology vaccine, which is being done in the US, the UK, the major side effect is fatigue and tiredness, which happens in about 70% of people. So it's sort of a mixed bag. And I think when we talk about the vaccine, we do need to be cognizant that it's not just one vaccine. There are actually 6 vaccines, and within these 6 types, there are many subtypes. So it's difficult to generalize.
But then you feel all age groups are, they'll all have a similar protocol, or would you vary it with youngsters, with older generation? How would you see this?
So here, this is a unique situation where, we're not thinking of this vaccine for youngers and for children. When we think of vaccines, we think of children. But over here, we know COVID-19 really disproportionately affects the elderly and the adults. So with all of these trials, actually, children are not even part of the trial. In other words, a lot of children will not be able to get this vaccine after it comes out until we study it in them. And what we're looking for really is a vaccine for adults, and especially the elderly, not really children in this case.
Right. Omair, I would like to bring you in over here. I mean, I want to take a different sort of shape to this discussion. I mean, you've dealt with the media. You understand how media works. how do you think government can sort of inform the people? Because I've heard the word information, misinformation. Ali mentioned it, Roxa mentioned it. How do you think the media can be used how can the government use the media, the machinery, to promote information or to give an idea what this is all about? Right, Omair, can you hear us? Okay, I think we're having some issues with him. Ali, I'll come to you. I wanted to ask this question earlier on as well. Do you think there is an understanding
Well, allow me to
about?
first apologize. I'm using this mobile technology right now because I'm stuck in this traffic, knowing uncertainties.
Yeah, Ali,
Media, I think, will
come
all
to you.
government will go back to its
Okay,
traditional means of using media, as it has always been the case. Creating awareness. Yes, I can. I hope you guys can as well, and have heard my apology to begin with.
Yeah, Omair, go on. We can hear you now, so we can continue.
So, I think the government's going to use media in its most traditional manner. It's going to do the same stuff which is done in all kinds of awarenesses. It needs to be a little looked at again, other that you've got certain figures, public figures, which are always respected and trusted, that you will go with that. It'll have to go with the more the emotional connect that works with it. Unfortunately, that is the right way to go about it, because the logic and rationale will not work. And the more organized and structured that the execution can come across, perhaps then people will get more confidence with it as well. Because in the streets, we even have had people not believing the existence of COVID to begin with, let alone the
Right, right.
solutions and the possible.
Yeah, yeah.
And one
That
clarity
is
that the government will have to do is that it is not a cure for COVID, it is preventive vaccine.
right, right, right. Ali, I'll bring you in over here. I mean, this is one aspect. Now, if you look at other campaigns like the polio vaccination drive that the government has had, and they've used the media extensively, all political parties have spoken about it, and we've had seen agendas and work on it. How do you think it can become more potent? I mean, what can be done? Can they involve the youth in any way in that sense?
I think the use of media is a very, very good platform to get access to not just kids who have access to social media. I think it's very important for us to also extend the conversation to beyond to the space where kids perhaps do not have access to mobile phones or do not have access to social media. But the general notion, and somebody very smart also sort of said this some time ago, that the general notion amongst the young kids is that they're very indestructible. And that's the general notion around COVID as well.
Yeah, but
So I think
they're carriers.
social
They're
campaigns
carriers. I
that
mean, they need to be careful with that.
yeah, but they are carriers, but the notion that they believe in is that they are indestructible. And I think the way in which a lot of government campaigns have in fact worked. So, for example, even the campaign around child protection that was used all around social media and by a lot of governments. I think those kinds of campaigns are very, very effective to get to a larger mass, the audience. And I think it's also very important to engage schools through government directive or not, but engage
Right.
schools and have projects that are more localized to areas, perhaps projects that are more focused on involving the young people, because I think in most cases we tend to sort of like direct as opposed to engage and involve and bring young people to the table and ask them as to how they feel they would listen the best. And I think in such cases, especially when there is in fact a lot of misinformation out there, when we don't really know what's going to happen, when a lot of things are kind of up in the air, when a lot of experts are also really struggling with this unseen turn of events, I think it's important for us to listen to young kids to see what they would listen to more.
Interesting. Dr. Faisal, I mean, what are your views on this? Don't you think we should have a little more open discussion of this, a little more information, especially in the media?
Sorry, I had to unmute. So yeah, I agree, and I think getting people on board with the vaccine and also with COVID-19 is really important. And I think I sort of want to add on to what you said, that we feel that youngsters are indestructible and they are carriers. But keep in mind that with this disease, I've realized that sometimes not dying is not sort of we talk about how many people died of COVID-19, but we don't talk about people who got COVID-19 and then have a prolonged illness for almost sort of 3 months to 6 months after that and not getting better. And we've who can no longer sort of compete because of this disease. So these people are never captured, and I think young people understand this, and we do need to engage with them. That not only are they putting other people at risk, but they may not get really sick, but they could get sick enough that it would affect their life later on.
Right, right. But Dr. Maryam, you are obviously associated, you're helping out the government as well. I mean, you are in the right corridors out there. What is the mood there? What is the sense there? Is there panic? Is there strategy?
I don't think there is any panic there, but there is definitely a strategy. There is one thing that I've noticed over the meetings that we have been having in the Corona Expert Advisory Group. Sometimes we preemptively suggest something, and in fact, we tell the government, like many days in advance that this is going to be happening. But somehow I feel that they don't take it that seriously. I mean, the healthcare workers, the specialists have all been literally telling them day in and day out that we will have the peak, in winters. We have to do something about it. But the more we talk about it, the young crowd in particular, they ignore the SOPs. So I just don't understand what is really happening from that point of view, because on one hand, we are having the meetings almost, twice or thrice a week. We have all the points in front of us, and we convey this to the federal, side. But somehow the decisions, I'm being very open about it. I don't work for the government as such, but I do work for my country and for my nation. That's what I feel. So I think they do have a strategy, but somehow it's not being translated exactly into the way the specialists want it. I think Dr. Faisal knows what I'm saying, because we all feel that we have been conveying day in and day out what has been happening, extrapolating, telling them this is coming. But again, the decisions that we see are sometimes quite opposite to what we expect those decisions to be. And
But that
could I
must be
add
very
something here?
frustrating. That
Yeah,
must be
sorry.
very frustrating coming from a technical perspective. I mean, you get embroiled in the politics of it.
Yes, absolutely. In fact, last time when we had the meeting, I just mentioned that. I said, look, we are coming here, and we are giving all our time and efforts, to get together, and then we, have something that we just want the federal, side to know that this is what we want. And then the next day we see something entirely different in the newspapers. So that's really kind of, paradoxical, I think. And also, I feel that there was one point that you mentioned about polio as well, because I'm also a member of that committee. So I know how much hard work has gone in, but we can't compare the polio. That has been very, very political, religious as well. With corona, we have a different situation. People want the vaccine, but there is no vaccine. And we may have to wait for many years, like we had to wait for 3 years for the H1N1 PDM09, which is a swine flu vaccine, because it was in America available everywhere. And we got it like 2 to 3 years afterwards, because we were just at the last rung of the, that chain. But now
True.
people want it. So they want it
Yeah.
now. It's not like polio. Polio, they just hate. They don't want to look at polio. And it has been politicized so much. But now I think maybe we can help the polio campaign as well. We can help the NCC as well to get on, because it's just that last thing which we are unable to get to grips with the polio with the polio campaign. So now with using the COVID model, I think people are really quite charged. They want the vaccines. So maybe we can just, use that opportunity to push,
Interesting.
the polio as well. That's what I feel.
That's interesting. Ali, I heard Dr. Maryam talk about, violation of SOPs and all by the youngsters, and, they're not. I mean, how much more serious does it need to become for them to understand the gravity of the situation? I mean, I'm sure it's all over. I mean, they're missing schools. Schools were shut. The markets were shut. The whole country was shut. The world was shut, for that matter. So, what level of seriousness do they need to understand the gravity?
I think we have to sort of like look at the spectrum of when we refer to kids and children. So this is not just, people who are in A levels, who sometimes we also consider kids, but also, O level kids who are in O levels, kids who are in middle school, primary years, across the board. I think in a lot of instances, and this of course comes from my personal experience, as I do go to a lot of different schools, and I am connected to a lot of different schools in different capacities. I definitely see that schools, given that it's a more regulated environment, SOPs are followed. I can vouch for this. I think I've seen it happen myself. I think teachers sometimes do, in fact, take extra responsibility to ensure that the classroom is safe, the classroom is protected. Do instances of some violations perhaps in schools happen where you see two kids walking together and you tell them to sort of maintain the distance? Of course, it's about management. And I think schools are a more sort of regulated place where you can have that management. But I think when you go beyond that scope, because kids only spend so much time in school, and it's about the time that they're spending outside of school as well, where the same needs to be reaffirmed, let's say perhaps by parents, and the community in general. A good example of that would be, somebody said the other day, why aren't people who are going out on, who are projected to go out in public on TV wearing masks? Because we haven't sort of accommodated for that in our media per se. So the general notion of it is that if you do go to a certain market, it's okay because nobody else is wearing a mask, and it's kind of like, it kind of gels in and blends out. And places that are more regulated. So for example, even right before Eid, I remember this was like quite the talk of town, where everybody was going out and everybody was going to markets, and there was a debate about whether we should have markets open or whether we should have malls open. And the idea was that because in malls you can have more regulation and you can have people wearing masks, that seems better as opposed to open markets. So I think the same kind of logic applies to kids as well, and their access and the information.
You've raised an interesting point, and I would like to take Dr. Faisal into the loop for this one. I mean, there's an ongoing debate that we should shut down schools, and there is going to be a decision on Monday. We had a resolution come out of the Sindh government today. You're dealing with the provincial government as well. What is your belief system? Because there's one school of thought that feels that school is the hotbed and we should, shut them down. The others are saying, why just schools when the markets are open and everything else is open? So what is your take on that?
So my take actually is that we should probably not be shutting schools down as a primary method of controlling the virus. So we have to look at this in continuum. Schools are not sort of the only thing happening out in the community. And if you look at the high risk behaviors or high risk areas where the virus would spread, I agree with Ali. I mean, the thing is, you look at you look at weddings or other congregations for other reasons, especially indoor ones, where we know the virus can spread really, really effectively, and we have pretty much we don't really have a good way of ensuring SOPs. While schools are a place where we know that some degree maintain SOPs. And you're also actually testing schools. So at least I know in Sindh, and I'm sure in Punjab also, we're testing schools periodically and seeing what the rates are. And over here, our rates are about 1% or so. We do, we have some schools with some spikes and some schools with less. But it's an area which is heavily audited. There are good SOPs, the SOPs which are easier to follow, and also being constantly monitored. So given these three things, and if you compare this to, say, a wedding, where you have a lot of people who are vulnerable, who can die of the infection, you cannot follow SOPs. It's an easy debate that way. Now, obviously, if the rates become so high that you start shutting down everything in the society, then schools will go with it. But I don't think it's a primary way of controlling the infection.
Yeah, Dr. Maryam, that seems to be the focus. I mean, I know schools are, under a great focus out there. And Sindh, like I said earlier on, has clearly said that they don't want schools to shut down. What is the take over here? What's the sense over here? What do you think?
Yes, we had the meeting of SIAG, I think, about a few days back, and exactly the same thing was discussed. The consensus was that we should not close the schools. We did look at the data. The data was presented to us, as Dr. Faisal also said. We had the data, and there were just very few cases, and I think SOPs were being followed in true letter and spirit. That's why children were fine, and there were just few cases. So all of us agreed that we should not go for this, type of action for school closure. On the other hand, I had suggested that we should only allow up to 50 people in a wedding, in a gathering. And I was literally heartbroken when the next day there was a big heading in the newspaper saying that they would allow 1,000 people for a wedding, an outdoor wedding. I literally fainted. And I obviously thought that this is it. I'm not going to go to the SIAG meeting anymore. Because, the problem is you're suggesting something and everybody said, no, let's make it 200, not 50. And I said, look, if you say 50, it'll go up to 100. People will be breaking some rules. So keep it 50. Let's push it to 100, the maximum limit. But, don't go beyond that. And then the next day you see that they have just decided 300, 500, 1,000. So I think main transmission of infection is not taking place in the schools right now. As Dr. Faisal also mentioned, I think it's, the weddings and it's the get-togethers and it's that, remember that tiger force. Can you remember that? Thousands of people without masks.
Yeah.
So how can you tell your community to wear masks when everybody is, not wearing any mask? So it doesn't make sense. It doesn't add up. We have to be, unified. I think we have to be unified in this approach. And I have been in this, in this for the last many, many months, sleepless nights, being in charge of the infection control at a big hospital. And believe you me, what I've used, mask, face shield. And in fact, at times I wasn't using my N95 while I was, looking at the patients, going to the wards, training everybody there. And I've had my test done about 7 times. Every time I thought I'd picked it up. But believe you me, a small face shield and a normal surgical mask and N95 when I was visiting the patients. That's all. And I've been fine, alhamdulillah. And I've had my tests, done along the way as well. But I think if you are careful, if you just watch your hands, if you just watch the distance between the other person. For example, if somebody is walking through the door, swing doors in our college, I just stop, I move back. The person is moving towards you, you move back a bit because then the distance is just 2 to 3 feet. So everybody is developing this habit now with passage of time. The students are very careful as well. We also had some cases of positive, patients, positive students in the college, and we had to shut our college for 1 week, but not more, because everybody was in favor of this, that we must keep on at it, improve the SOPs so that we cut on the transmission. But, the weddings, yes, I'm not for it at all.
Yeah.
That's not the way to
Maryam,
move forward.
your comments have probably made you very unpopular with the students who really want the schools perhaps to shut down and sit at home.
Yes.
But extremely popular with the parents who perhaps want them out of the house.
Yes.
This is the point you've raised. Dr. Faisal, I mean, I know health is a provincial subject. I know it's come down to the provinces to decide. You're also working with the federal government as well in the advisory capacity. If push comes to shove and they say you better shut down, do you believe that this should be phased shutdown or there should be abrupt? What do you suggest?
That's a good question. So keep in mind that currently our schools are already staggered, and you know this, that our classes are staggered temporarily over time. You have some people coming in morning and evening shift, or some schools are doing sort of 3 days on, 3 days off. So we're already not working full time, all schools open, all days on. So I guess if the schools shut down, it'll be sort of an abrupt shut. And you remember, if schools are shutting down, in my mind, that means things are so bad that everything is shutting down, and schools included.
Right. Interesting. Ali, I just want to change the sort of tone over here now and sort of ask you, I mean, do you think there should be a choice? Should people be given a choice in case the vaccination is there, that you should, if you want it, you come and get it. If you don't, we won't force you. You think the choice element should be there?
I think that's a tough question to answer because I am pro-choice in all cases. But I think when it comes to medical terms, and that's the kind of information that shouldn't go out. When it comes to medicine, when it comes to conversations about health, something that I mentioned earlier as well. I think we best leave it to experts and follow their lead and see what they say. I think that's the only way in which we can sort of cut down on the information that is going around and the information that shouldn't be circulating, especially amongst the young kids. It's also sort of important. So, for example, if you were to extend the same notion of choice to, let's say, students who wanted to opt for online school or physical school, I think that kind of choice extends there as well. I know a lot of my students have come up to me to complain about other schools and formats that they're taking. But I think the way schools have adopted in a hybrid system in such a short amount of time, where we had to adjust for classes online, we have to adjust for physical classes, where it's become a hybrid system. And I think that shows the adaptability of the education system, and it is efforts that administrations put in, policymakers put in, teachers put in, and even for that matter, students and parents, because I don't think that any of this is successful without their input and without their effort.
No, I second you on that. It's not been easy at all for schools. I hear it's a really tough situation. The administrators have worked double shift along with the teachers to make things sane out there. It's not been a regular academic year for schools as well. So it's been a tough situation, definitely. But I want to bring the same question out to both of you as well. Dr. Faisal, what do you think? Should there be a choice element? Or should that be a compulsory thing, as we call it, merit-based economics?
So I don't think you can make it compulsory. So any intervention done on anybody, there's always a choice. You cannot do compulsory, really any procedure on anybody, because it is your fundamental right to refuse, and that is actually, in our mind, a problem, because we have a lot of anti-vaxxers, and we know that outbreaks of infections occur because people refuse the vaccine for whatever reason, and everybody has their own choice. So here, I don't think I don't think we have a choice to answer the question. I think the answer is you can't force this on anybody. But I do want to point one thing out, that we also have to keep in mind that this vaccine may not prevent the infection. So the common notion is that getting the vaccine and you won't get COVID may not be true. We know that with most vaccines against respiratory viruses, what the vaccine does, it makes the infection less severe. So you won't die of it, but you may still get it, which means that you may still transmit it. So that's sort of a little bit of a nuance which tends to get in the talk.
And Dr. Maryam, what's your take on this? Are you as democratic as they are?
Yes. Yes, I think I feel the same, because I think with this vaccine, you are not going to face this because people want it. I've heard so many people asking me continuously, when do you think the vaccine is coming? When are we going to get it? And I tell them, look, you have to wait, be patient. And also, just see how things go. Because, this is a new vaccine. It's an mRNA vaccine. We don't know how it will work out at the end of the day. I'm sure it will work fine. With the data that we have in the interim analysis. But still, I think it's something for which we will not have to do much pushing. People are going to be asking for it. Most of the people would. I think they want to get back to their usual lifestyle. That is the main thing on their minds. Honestly, it's not like polio, So
Right.
people just want this vaccine. Yes. So you don't have to push them. I think they will want to have it anyway. It doesn't matter if they are having, some pain here and there. But I think, yes, with the side effects, with fatigue and with the fever and all that, some people did get the infection who had the 2 doses of the vaccine as a volunteer. So we have to keep in mind, as Dr. Faisal pointed out, that it's not going to be, a prevention kit for everyone. There will be some who will not benefit from it. Just like the flu vaccine, I think 70% effectiveness, or even less than that at times. And for this, we don't even know how effective this would be. So I think time will tell.
Yeah, Hera, I want to bring in a question, something that came out of nowhere. Actually, I was talking to a friend about this session that I was going to moderate today. And I didn't know that the domestic help at home, he was cleaning and he was listening into the conversation. So when I put the phone down, he asked me, sir, will this be available for us? Will we be able to afford it for our families if this was to come? Will it even reach us, or will it reach the rich first and maybe the leftovers will come to us? We'll scramble over. So I thought it was a very valid question, and I really
Yes,
wanted
it's a very, yes, I think it
comment
will reach us thanks to Bill and Melinda Gates Foundation and the Gavi Alliance and everything. I think they have been putting so much work into this for making it equitable for everybody. You know, I think this is what we have to keep in mind, that now the world has changed. And it has changed quite a lot over the last 2 decades. I think Dr. Faisal would agree that now the vaccine delivery for third world is not as bad as it used to be when we were younger. And I still remember, you know, in 2008, was it 2009, when we had the H1N1, the swine flu. And,
right.
you know, at that point, it took quite a while. But I think now things are different. If it comes, I mean, look, it depends on how much money you have and how much advanced booking you have already done. Just see, people have already bought a vaccine which has not been even prepared. It is not in the vials even. It has not had the authorization, and still people want to buy it. So I think we will get some of it eventually
Right.
for all our population. Yeah.
Interesting. Dr. Faisal, do you agree? Sorry, you're mute. We can't hear you.
Yeah, I keep losing the mute button. So, so yes, I do agree. I think, you know, so this time around things are a little different in that even before the vaccine is here, people have already started the conversation about vaccine delivery and making sure the vaccine comes. And exactly what Dr. Maryam mentioned, you know, the COVAX alliance, which is alliance of which Pakistan is a part of, which is between WHO, CEPI, and Gavi, which are three big organizations,
Gavi,
obviously. Yeah, we'll make sure that about 20% of the population will have enough vaccines in the first get-go. And if the vaccines are really, really short, then obviously it'll get to those most vulnerable first. So this may actually not be as big a commercial enterprise. However, having said this, I do know drug companies who are making the vaccine also and trying to sell it. So you actually have two pathways probably ongoing that will come. What vaccine is going to come and who will get it? I mean, there is already a group working on it. I'm not officially part of the group, but they do consult with me every now and then. And I know that we've already pre-bought the vaccines. So it's an unusual circumstance that we don't have the vaccine, but the manufacture started. The distribution thought has already started. And hopefully once it's here, maybe in mid next year, we'll know how it's going to get rolled out.
Right, right. Omair, thanks for joining back. I'll continue with the question for you. I mean, you travel around the country. I'm sure you get to hear various views and voices from different parts of Pakistan. I was talking about the fact that there's a general fear that the marginalized segments of the society, a certain particular income group, will not have access to the vaccine, and that's what they fear. Do you think that's true? Is there any potency in that fear?
First of all, allow me to apologize again. I finally managed to station myself to a better connection here. And I think the punishment that I've received is not being able to catch in great parts of the conversation in between. Regarding the fear, I think, and I'm an eternal optimist, but what I'm looking from people is, again, it's a combination of the people who believes in it as much as as it is, because it's the urban sector to begin with. I've noticed the urban populations where this virus has been more effective and people have bought it, the fact that it exists to begin with. And in the suburb, they really don't have that much of an effect, or maybe perhaps they don't even believe in it much at the same time. So setting the vaccine in areas of suburban areas that I've so far been able to visit in this last year itself will obviously might be a priority because the age factors, the vulnerability factor, but really isn't the priority in terms of what the people will perceive. I would think that, and I would trust that the NCS, etc., they've got fantastic data at the hand as well now. Something which we've never seen in the past in Pakistan, to be honest, at least not to our perception even, the data that has been received. So they would perhaps go with that particular data to begin with. it will then again trickle down everything which more or less has been said earlier today, which is the mohalla, for example, the mohalla who knows that someone has experienced this COVID or has, God forbid, passed away or lost someone to COVID, and their buy-in to the entire aspect, and therefore being able to propagate and pass it down from mouth to mouth and letting people know word for word that this is necessary. And I think there the buy-in will exist, and there the buy-in perhaps is also needed. But for the huge majority, it still comes back to a lot of misconception and misperceptions, and a lot of those, Elias was mentioning, the WhatsApp groups, which will be telling you all the things which is perhaps not even true.
Right. No, I'm glad you mentioned that. You mentioned another important point of mohallas acting up on this, and I hope governments across Pakistan hear you and go for local body elections and install a government that deals with mohallas. Ali, I'll come to you. I mean, this is a question that has been questioned before as well. People are not just fearful that they won't get it, but what price? I mean, is it expensive? Is it going to be cheap? That's another question that people also fear, that will it be too out of reach? In that sense, I mean, what's your take on it? Do you think the government can subsidize it, or get it cheaper for us? If it's cheaper, is it qualitative?
I assume that question was directed to me. I think, of course, given how how our society operates, I think the first pick should always be the most vulnerable, and that has always been the case, the way we operate. And I think healthcare has always been a sensitive matter, and especially in this pandemic, it's really tested the government structures for healthcare facilitation. And I think in this specific case, the government should, in all circumstances, put as much effort as can be. I mean, I wasn't aware of the programs that both the experts have just mentioned, but I think those are great initiatives to really allow a playing field effect and accessibility to everybody who could potentially need it. I think there's gaps between people who can afford and who cannot afford. Every day we lose people to health problems purely because they can't afford healthcare. So I think in this specific case, and might I add, I think the young community in this specific case, and this is of course this anecdote, that I see a lot of young students sort of putting up posts and gathering small funds that are more localized for people who are going through bad conditions, or perhaps need the kind of support and help. And I think not just the government, but the community by itself, and especially the young people generally do come forward in this case to provide support and mobilize, and as Dr. Maryam mentioned earlier, walk under a unified sense. And I think those kinds of directions are very important for us to move ahead.
So I have a technical question. I would like to bring in the two doctors and onto this to get your opinion. I mean, there's a question about the distinctions between Pfizer, Chinese, and the third vaccine. Which one is most likely to come to Pakistan earlier? In case it does, are there any medical differences between the three? Dr. Faisal, if you can answer first.
Sure. So I think there's a huge difference between each of these vaccines. And here I'm going to go a little technical just to explain this a little bit. So a vaccine essentially is a way that you trick the body into thinking that it's got the infection. So it starts making the antibodies and the immunity, and so that when you get the real infection, your body's ready to fight it. And there are many different ways to trick the body. The Pfizer and the Moderna vaccine, in that case, what you're doing is you're giving a little bit of the instruction to the body on how to make part of the vaccine, part of the virus, and the body feels that it's getting infected, and so on and so forth. The Chinese, actually, there's no one Chinese vaccine. The Chinese actually have 4 different types of vaccines. There's one that you may have heard about in Brazil, for which the trials were stopped. In that case, they have the virus, and they've sort of killed it, and they're giving it to the person. The one that we're doing the trials over here, what we've done is we've taken a completely different, a very sort of harmless virus, and we've inserted a little bit of the DNA of COVID into it, and then we give it to the person. So the person thinks that they're infected with COVID, when really it's a very harmless virus, almost like a like the example people give in a sheep in wolf's clothing, the other way around. And then there's another Chinese one in which they actually gave just a little piece of the virus. So they're actually very, very different vaccines. Which one will we get over here? So probably the one that we're doing the trial in over here is one that we'll probably almost certainly get over here. There's another Chinese vaccine in which you're giving a little piece of the virus that may come over here also. I know of an Australian vaccine that we're sort of currently looking into. Also, that may come over here. So there are a number of different candidates that may actually come over here. The exact one has not been decided on as yet. We sort of shortlisted which ones we're going to get. And I think a lot of conversations go into the cost, but also exactly what Dr. Maryam had mentioned, the deployment. How easy will it be to give into the population? And then the efficacy, how well the vaccines work. And we just don't have that last information as yet, and that's why we're doing the study. So a little bit, I'm sorry, technical answer, but that's sort of where we are.
You bombarded us with the technical words. Now I should impress you with my economics and use terms that won't be easy for you. Dr. Maryam, I'll change the question a bit. Over here, I mean, we've heard both of you mention that children don't need the vaccine. Now, is that a general opinion or a medical fact?
I think in the trials they have had children, as volunteers. I think maybe up to 13 years of age. I was just going through the details. They have used some, volunteers in the Pfizer probably, where about 100 children they have used. So they have tried this, this new vaccine on young children. So presumably they will be using those eventually on these children. But I think it's important to vaccinate the children. Our focus, if you remember all the 20 plus vaccines that are being used on population of children all over the world, they are all important infections and we focus more on children. I think for COVID, we can't really just ignore children because they are spreading the virus at home. They may not be showing many symptoms like adults, but sometimes they can be quite serious as well. As we saw in America, I think Dr. Saab can shed more light on that with the different syndromes that were being observed, in children as young as, few months, maybe, infants. So it is quite possible that you can see very serious manifestations of this disease in children, yet unknown to us. Time will tell, I think. We are seeing lots of different things right now. Even, some of the colleagues are having diarrhea. Adults, they are having diarrhea first for 3-4 days, then they have the flu-like illness on the 4th day. And I've already seen about 5 people in our hospital who have the same symptoms. They said we had diarrhea for 2-3 days, and then they had the flu-like illness, and they are all coronavirus positive. So we are not sure how these symptoms will come up eventually, but I'm not saying that the virus is changing, but definitely the way it is presenting and the symptoms. Some people who had it 4 months ago, they said they are having memory loss. Young nurses. Somebody said, I've lost all my hair after corona. So it's very, very strange type of symptoms that people are saying. But most of them, they said they have had fatigue, and they can't even move their fingers. They can't go back to work. So, adults, children, I think everybody will need this vaccine eventually if we have to get it over with. It's quite a new thing for us. I mean, as a virologist, I'm really surprised at the easily this virus is transmitted to people around us and the havoc. I mean, look what has happened. Our world is completely upside down in 2020.
Right. But Dr. Faisal, Dr. Maryam earlier on mentioned, the frustrations in terms of dealing with the government, in terms of the technical areas that they were covering, and then the government would come back on a very different tone altogether. I mean, you having dealt with the federal government as well as the Sindh government, do you feel that there was a coordination or there was, a lack of coordination? What was your take on that?
That's a very charged question you asked me. So the answer is depends. Gonna get me in trouble. But so the answer to that is it depends. It depends on what sphere we're talking about. I think there's always been an attempt to have coordination, but obviously, as with any issue, there's not always agreement that's happening at one point, and sometimes the province or the provinces may decide to override. I mean, in a way, what the federal is saying, and sometimes they'll go in line. You have to also keep in mind that each of the 4 provinces or 5 provinces are actually very different in demographics and their health capacity in the health systems and where the virus is amongst each of these provinces. So one shoe does not fit all. I think what the federal has been trying to do to some extent is to lay broad guidelines which then the provinces can work under. But I know I'll give you the same example Dr. Maryam just gave of the 1,000 wedding sort of a limit. And I was in the NCC meeting where this was announced and we had been given this beforehand. And we all sort of shrugged, and we had actually all said that we probably will not be following that particular rule. So I think there is coordination, obviously. I think, and to be very honest, I think I'm surprised at the level of coordination to some extent for this infection that has come up really quickly. If you look at other health systems that we haven't actually been able to develop a surveillance system, and we have, and that all takes coordination. So yeah, I think it depends on what sphere you're talking in.
Nice. You're a diplomat as well. I'm not just a doctor. Well, one general question I would like all of you to answer very briefly because you're short on time as well, that if you were actually the government and you were to decide something as, say, a health minister or whatever, what is it that you would do which you feel that the government is not doing or could do better? Ali, we'll start with you.
I think if I was somebody in charge, I'd start with sending out clarity. I think I'd start with getting rid of this notion that is affecting everyone, where everything's up in the air. Even if the experts aren't coming back with answers, let the people know. Let parents know, let kids know, let institutions know, let businesses know. Because if there is uncertainty in terms of we don't know, that's okay. But I think there is a lot of curiosity that the government
Right.
could potentially create by the words and the way that they package what they say. And that really doesn't leave a good space for the rest of us. So I think the way that I would start this would be probably, get as much information out as
Sorry,
possible.
Ali, I have to go to Omair now. We're short on time. Omair, quick word on that.
I would follow up with Ali. Frankly, that is true. In the short and immediate run, would be to make sure that you have certain clarities and not the misinformations, etc., which is not very easy to address, to be honest.
Yeah.
In the longer term, and I think it's in retrospect, I'd also second what you had said, Taimur, earlier, that if there was a little more, trickle down to the power and authority to the muhallas and the UCs, it further helps the coordination and the information as well. So it's a learning for us for future now.
Yeah, no, that's a valid point. Dr. Maryam, what about you? What's your take on this? If you were given the charge, what is it that you do differently?
Yes, I think if I was the health minister, I would be wearing a mask everywhere that I went. I would be showing all the people how to wash hands. I'll be showing them how to wear a mask and how not to contaminate a mask. And I think this is what I will do straight away. And after every 2 hours, I would tell all the channels to show a small clip or a video or a cartoon where they would just tell you how to protect yourself. I think this is what we have to do. We have to give a clear message. I agree with all the other, Mr. Ali and Mr. Omair, they said that as well. I think we have to give a very clear message. Video or chat shows or messages or text messages, I think this is the way forward for all of us. But we have to start with us. If we are not wearing the masks and we are all over the meetings and on the television, it doesn't give a good impression at all.
Right. Dr. Faisal, what about
I'm
you?
quite honest and straightforward.
So I think it's unanimous. I think, and this has been my conversations with everybody, that we have not seen that media drive or media push towards normalizing this disease, normalizing masks. What
Yeah.
you said, and that's sort of the one thing I would change.
Yeah, it does make an impression. You see somebody in power, not following the protocols. How do you tell the rest to do the same? You all mentioned rumors, and this one rumor which went around, which came around, was that the vaccination contains a chip. If we have the vaccination, then we'll have the chip within us. They'll be able to track us. I mean, how do you deal with such things? I mean, it's very, very difficult.
I'll get this one. I tell people that you already have a chip in your pocket with your cell phone, which tracks you everywhere.
Exactly.
You don't really need a
vaccination.
injection, and yeah. So and there are no chips in these vaccines.
Yeah. True. Great. I think these are really important points that we've discussed and mentioned. It's been really interesting to hear very different perspectives, and I'm glad there's diversity in the panel here today as well. And there's a lot to take back from this, from a technical perspective as well as social perspective. I think we've had some great input from all of you, and I'm hoping the viewers would have enjoyed the conversation that we've had. We'll have more sessions on this topic and perhaps related to this as well, and hopefully we'll have you guys there again. And we would hope that Dr. Faisal is less diplomatic next time than he was today. But thank you all for joining in, and thank you, viewers. I hope you all enjoyed this very interesting conversation, and you had a lot to learn from, because I'm sure all of us did, certainly. So thank you once again. Have a pleasant day, pleasant evening, wherever you are. Goodbye. Khuda Hafiz.
Thank you so